This is part 4 of the health assessment recap of the PMHNP Review and Resource Manual. It was going to have just 4 parts, but after 35 slides, I decided to finish and add a 5th part probably in the next couple of days. Disease prevention activities. Immunization. Immunizations are critical to preventing disease according to the U.S. Centers for Disease and Control and Prevention, the CDC. Immunizations protect individual children and adults from developing potentially serious diseases while also protecting the community by reducing the spread of infectious disease. Schedules for children and adults are available at the CDC website. This section is going to be about the influenza vaccine and the annual vaccine recommendations, live attenuated influenza vaccine, an egg allergy, and the immunocompromised population. The influenza vaccine. Everyone 6 months or older should receive an annual influenza vaccine. 6 months to 8 years old require 2 influenza vaccines 4 weeks apart. The live attenuated influenza vaccine is not for anyone that is younger than 2 years old, and the long attenuated influenza vaccine is not for anyone older than 49 years old. If the person has an egg allergy, they should always receive the vaccination from a healthcare provider that is familiar with the potential reaction and should be observed. The patient should be observed for at least 30 minutes post the injection for signs of a reaction. People who should not receive the live attenuated vaccine are immunocompromised, pregnant, and high-risk medical conditions. The HPV vaccination is for girls starting at age 11 and then a booster shot after the age of 12 through 26, and the HPV-4 vaccination is for boys aged 9 through 26, and there's just 1 shot needed. The boys' HPV-4 vaccination is to prevent genital warts. The girls' HPV vaccination is to prevent HPV infection that can cause cervical cancer and genital warts. MMR, measles, mumps, and rubella vaccination is not for pregnant people, cancer, immunocompromised, HIV/AIDS with T-cell count less than 200, currently being treated with steroids, and blood transfusion received within the 2 weeks of an MMR vaccination. The Tdap, diphtheria, tetanus, acellular pertussis, is not for anyone younger than 7 years old. TD, or tetanus diphtheria vaccination, should be given to people every 10 years starting at the age of 11. Shingles, or shingles vaccination, is also known as herpes zoster, is an inflammatory condition in which a virus produces painful vesicular eruptions along the distribution of the nerves from one or more dorsal root ganglia. Recommendations for the vaccination of shingles shingles vaccination is for anyone that is 60 years of age or older who has had a history of having chickenpox. The shingles vaccination or herpes zoster vaccination is not for anybody that is immunocompromised or HIV/AIDS with a T-cell count less than 200 or currently being treated with high-dosed steroids. The chickenpox vaccine is the varicella vaccine. It's not for pregnant women, persons with weak immune system, HIV/AIDS with T-cell count less than 200, or cancer, or for people being treated with high-dose steroids or who received a blood transfusion within the previous 2 weeks. Anticipatory guidance. Anticipatory guidance is a framework for implementation of prevention strategies, based on the premise that information can be provided to people to help them cope more effectively with events that occur along the lifespan. Within the framework of anticipatory guidance, the practitioner seeks to determine the specific informational needs of the client in a systematic, standard way. Pediatrics. Soliciting information from parents about their concerns in parenting and providing information specific to their concerns. Teaching parents about health hazards and strategies to prevent harm, such as car seat safety, water safety, wearing helmets, and so forth. Bright Futures is a national health promotion initiative launched by the Health Resource and Service Administration. It's dedicated to the principle that every child deserves to be healthy, and that optimal health involves a trusting relationship among the healthcare professionals, the child, and the family and the community as partners in healthcare. Expansion of the model includes screening, care management, and education about mental health problems and disorders in the developmental context. In specific healthcare situations, anticipatory guidance can be used to assist people in meeting healthcare challenges across the lifespan, and some examples are coping with terminal illness or death and dying, such as anticipatory grief, coping with disease progression, such as with Alzheimer's dementia or in a loved one, and coping with change and limitations resulting from spinal cord injuries. And these can be implemented in each well check to identify information needs pertinent to the client's current life situations. Some examples are the responsible use of alcohol for the adolescent going off to college, domestic violence, life after the loss of a loved one, for example through divorce or death, and planning for retirement. Now we'll move on to gender-based medical testing and screening recommendations for the general public. Tanner Stages Assessment defines physical measurements of development in children, adolescents, and adults. The development of primary and secondary sex characteristics such as breast, genitalia, and pubic hair are assessed by stages to describe the onset of progression of puberty in both males and females. Because of natural variability, males and females pass through the stages at different rates based on the timing of puberty. Girls' breast development. Stage 1 is pre-puberty. Stage 2 is breast bud stage with elevation of breast and papilla, enlargement of the areola. Stage 3 is further enlargement of breast and areola, no separation of their contour. Stage 4 is areola and papilla form a secondary mound over level of breast. And stage 5 is mature stage, projection of papilla only, elevated to recession of the areola. Boys' development of external genitalia. Stage 1 is pre-puberty. Stage 2 is enlargement of scrotum and testes, scrotum skin reddens and changes in the texture. Stage 3 is enlargement of penis, length at first, further growth of the testes. Stage 4 is increase in the size of the penis, with growth in the breadth and development of glands. Testes and scrotum are larger and the scrotum skin gets darker. And stage 5 is adult genitalia. Girls and boys' pubic hair. Stage 1 is pre-puberty. You can see vellus hair similar to the abdominal wall. Stage 2 is sparse growth of long, slightly pigmented hair, straight or curled at the base of the penis along labia. Stage 3 is darker, coarser, and curlier hair spread sparsely over junctions of pubes. And stage 4, adult type hair, but covering smaller area than in adult, no spread to medial surface of the thighs. And stage 5 is adult type and quantity with horizontal distribution. Moving on to wellness recommendations, wellness check recommendations. We'll start with women and then finish with men. All women ages 18 and up should perform monthly skin and oral self-exams, yearly blood pressure, UA, and physical exam, and pelvic exam, and STI detection. All persons and women 13 to 65 years of age should be tested at least once for HIV. Women and Pap smear recommendations. Pap smears are recommended for women starting at the age of 21 or within 3 years of sexual activity. Pap smears can go from yearly to every 2 to 3 years in the age range of 40 to 49 after the woman has had 3 consecutive negative results. Pap smears are not recommended for anyone over 65 if they've had a recent normal Pap smear and they're not at high risk for cervical cancer. Mammogram recommendations are yearly starting at age 21 and every 2 years after the age of 50. ECGs are recommended every 4 years for all women over the age of 40 years old. Bone density testing recommendations. Routine testing starting at age 65 and start at age 60 if there's an increase of osteoporotic fractures. So colonoscopy recommendations were a bit confusing. This is the best that I can do to recap it. So I believe it's starting at age 45. Everyone should have a colonoscopy every 5 to 10 years, and through the age of 75. So starting at 45 through the age of 75, every 5 to 10 years. Then a flexible sigmoidoscopy, a double contrast barium enema, or a CT colonoscopy. If any of these tests are positive, then a colonoscopy should be done. If they're in a high risk group, then it's going to be a personalized recommendation, a schedule recommendation. For hearing and vision screening, everybody over the age of 50, you could consult for hearing and vision. And then also for men, you would also consult after the age of 50 for a testosterone blood test. Now we'll talk about men. So men should have monthly self-exams of testicles, skin, and oral for all ages, all age men. And then there's yearly blood pressure checks, blood work such as CBC or CMP, thyroid, UA, and physical exam. Men ages 40 to 49 should have an ECG every 4 years. If over the age of 50, then it's every 3 years. So that's different than women. So 40 to 49 ECG every 4 years, but if over 50, then an ECG every 3 years. Men and sexually transmitted infection screening should have yearly syphilis, chlamydia, and gonorrhea for all sexually active men who are gay, bisexual, and men who have sex with men. So that's yearly syphilis, chlamydia, and gonorrhea for gay, bisexual, or men that have sex with men. For all men ages 13 to 65, HIV testing should be done at least once. This concludes this portion of the health assessment section. And one more section to go, and we'll start with exercise and talk about prevention and health principles, self-awareness, self-disclosure topics, and conclude with preventative factors. So one more part to go.